It's another day with the physicians where your health is our business.
With growth spot the end. So you are not going to take some drastic measures. But a 10-year-old coming, pressure is high. But also to know that it's not only when your pressure is high that you have glaucoma.
Sugar, and I don't know about any other one, but what do you know?
You're welcome back to the training also of your regular program. The most important thing to me was achieving internal strength, strength of the mind, the heart, and emotion. I was up for God's challenge for me. I started being a cancer ambassador to share my story, to uplift others. I felt myself open to receiving others and did not want to be seen as sick anymore, as I felt I was not. I trained my mind to be positive. I became active in cancer events, and there were such positive experiences. My husband and I joined various charities to try and help other patients, and also importantly, the caregivers too. They all should feel loved, needed, and supported in every way. My message to women out there is stay strong for your loved ones and not be discouraged. It is a struggle, but you determine what you will take on. I strongly believe in mind over matter. You can do it, and I hope my story helped. This message was given by one Mufira Aime, a 33-year-old diagnosed with infiltrating multifocal ductal carcinoma. Every year, about 24,000 women are diagnosed with breast cancer in Nigeria. What can we do to raise the hope, support, and strength for these women? Today on your favorite health TV talk show, The Physicians, we'll be discussing breast cancer, sharing messages of hope, support, and strength. It's another day with the physicians where your health is our business. My name is Dr. Martina Agbere, your anchor on this program. And I have with me my co-host,
Dr. Memuna Yusuf Kadri, and of course, this is your favorite health TV talk show where your health is our business.
And will always remain our business. So our topic for today is breast cancer, sharing a message of hope, support, and strength. Memuna, breast cancer. Especially in Nigeria, okay, we have about 24,000 women diagnosed
with breast
yearly
cancer.
With breast cancer. Do you think there's an improvement compared to the past, or do you think we're actually
I think the awareness
enough?
Yeah. So I think the awareness may be getting people to seek. No, let's not forget, even in medicine, we are being told that help-seeking behavior is more among the females than males.
Okay.
So that awareness could be a factor why people are coming out to. Let me even, I did breast examination, I noticed a lump and all that. But of course, we also know there are other factors, environmental issues, and that figure is is heavy. Like how many women, females we have then? If 24,000, it can just make you feel as if everybody walking on the street, maybe one out of 2 or 3 women.
I'm even, I don't want to use the word excited. I think I'm impressed, even for us to even have figures now. Unlike before. I want to actually commend the NGOs that are doing a lot of they're the ones actually doing more work. So I think what we need to do is more for advocacy and letting people know that screening is more important, okay? And I'm glad we have a guest, someone who is actually on terra firma, on what it has to do with cancer management, the breast cancer, cervical cancer. So, my dear viewers out there, today we'll be talking about breast cancer, sharing a message of hope, support, and strength. We'll be back after this short break. Welcome back. If you have just joined us, you're on to a regular program, The Physicians, where your health is our business. Today we'll be discussing breast cancer, sharing a message of hope, support, and strength. And in the studio with me, we have a guest. She is a clinical oncologist, the founder, SEBECCALY Cancer Center here in Lagos. She is no other person than Dr. SALAKO OMOLOLA. You're welcome to our program.
Thank you very much.
I welcome Dr. SALAKO. You look good.
Pinky.
Thank
You know,
you.
cancer
Everything
and
the colors.
pink has a very strong link.
Yeah. So now we're going to be talking about breast cancer, sharing a message of hope, support, and strength. But before we deep dive into that, can we just have a general overview?
The situation of breast cancer in Nigeria is, as you've said, a lot of women are being diagnosed, thousands of women every year. And in fact, 24,000 is a conservative figure. But one thing is for sure that it is the most common cancer in the country. It's the most common cancer affecting women from age 30s, 40s, and it gets, very common in the 40s, 50s, and 60s. In the past, about 3 decades ago, it was common that breast cancer would be found in the older age group, say 60s. But now we see that a lot of women are being diagnosed in their 30s, in their 40s, and it's disturbing. I think another point to note is the fact that breast cancer is quite aggressive when it occurs in the younger age group. So you see a woman who is 30 years old and another who is 60 years old. The tumor biology, the way the cancer will behave, it's likely to be more aggressive in the younger woman. There are many things that increases a woman's risk of developing breast cancer that we can not control. So when I'm speaking about the risk factors, I want us to just know this and know that we can control some and some we can't control. For example, breast cancer is the most common cancer in women. You can't determine your gender at birth.
Absolutely.
Breast cancer occurs with increasing age. You also cannot stop yourself from aging the periods that we age. But you can't also choose the family you are born into. Some families have breast cancer running in the 2-3 generations ago. For example, the popular one is Angelina Jolie, the American actress who her mom had breast cancer, her aunt, about 5 of them had breast cancer. So when children are born, or descendants are born into certain families that there is a known history of breast cancer, you just can't choose the family you're born into. But let's move on to the risk factors that you can control. It's clear that as you gain weight, it can increase the risk of developing breast cancer. So what can you do about that? You can control your diet, you can exercise every day, and reduce your risk. Breastfeeding has been found to be protective. The more a woman breastfeeds, it plays a role in reducing the risk of breast cancer. So we encourage women who have babies, who are nursing their children, to do as much of breastfeeding as they can versus giving the milk. But of course, this is subject to what each woman wants. the use of oral contraceptive pills to control family planning and birth control, that you have to discuss with your gynecologist. There are some contraceptives that have hormones that increases the risk of cancer. So you want to have an intelligent conversation with your gynecologist or doctor when you're choosing the oral contraceptive or whatever type of contraceptive you want to use. Another thing you can control is the age at which you will start menstruating or the age at which you will stop menstruating. Nobody knows those days.
Menarche and menopause.
But definitely we know that the longer time you have menstruating, it increases the risk of breast cancer. So a girl starts menstruating at age 15 and she achieves menopause at 55 years. That means 55 minus 15 years. She's been exposed to menstruation for 40 years, compared to another person who starts menstruating, say, at age 15 and stops menstruating at maybe 65. That's 50 years. So we say the lady who had more years of menstruation has been exposed to more estrogen and is at a higher risk of developing breast cancer. But when it comes to all of these risk factors, I would say that as Africans, a lot of these risk factors were done in the past, on other races, not necessarily. It didn't contain as many Africans as possible. So our reality in the clinic, in our population, is that some women, just started their menstruation at age 15, and by 30, they already have developed breast cancer 15 years. Wow. And they are fit, they eat healthy, they're in the rural areas, they've not been exposed to as much pollution as. So this is why we call them risk factors. They may just increase a woman's risk of developing breast cancer, and all the factors may be there, and she would just not develop breast cancer. Meanwhile, another woman would have all the risk factors, she won't develop breast cancer. Others will have these risk factors.
Yeah. So when we say message of hope in case of breast cancer, what does that mean?
It simply means, so if a woman is diagnosed with breast cancer, what happens? Her world shatters.
From that message?
Yes. And the reality is sometimes between the oncologists and the surgeons, some people don't want to talk about the diagnosis, and they push to the other set of doctors. So the patient is seated in front of you and you just, go ahead and say breast cancer, and you think someone else had done the diagnosis. And the reason why that happens sometimes, which is not good practice, is because it is so intense. The woman most times feels her world is over.
Yeah.
She's facing death. She's looking at death, just by hearing you have breast cancer.
Even thinking about it, it's scary.
Yeah. And it's because a lot of people hear cancer and the next thing they say the person died.
Yeah. As if it's synonymous with death, which is not.
Which is not. Because we do have a lot of survivors, but not many come out to
share their stories and the message of hope.
Yeah.
That is it.
So it is such a difficult thing because it will hit the woman in all areas of her life. Her finances, her body, her mental status. Her life will pause. The message of hope is, can you pick it and move? Or are you stuck there? And a lot of Nigerian women don't have that support to pick up their lives and move forward.
I really appreciate if you can walk us through it from the point of going for the screening, diagnosis, what is expected to be done. Then after that, what next if you are positive? If it's positive, what is the patient expected to do? How about the family, the support system? What are we supposed to really do?
Okay. So when it comes to breast cancer control, we can look at it in 5 pillars. The first one is prevention. Now, in breast cancer, we can't really prevent breast cancer for most people, the few people we can prevent breast cancer are those that have a strong family history of breast cancer. They've even gone ahead to do their genetic testing, and we can confirm that they have abnormal genes. Now, there are certain steps we can do for those subset of people. Okay. For example, Angelina Jolie, who had that positive history, went ahead to remove her breast and had a reconstruction, and she must have gone on certain medications that would help reduce her risk of developing breast cancer. So there's that part where we can prevent very few breast cancer cases if it occurs in the family. But the truth is, in Nigeria, about 95% of breast cancer cases occur without a family history. So prevention is very limited in that situation. However, you know, just living a healthy lifestyle and then going for your screening. So the second pillar, which is early detection, we promote that women should visit their healthcare facilities once a year to get their breast checked by a doctor or a nurse. And we call that the clinical breast exam. The second thing about early detection is to do your breast self-examination once a month. And you can choose the date that you were born. Say if you were born on the 5th of April, 5th of every month. Yeah, and it's just about knowing what is normal for your breast, what it looks like, what it feels like. You stand in front of a mirror and you check your breast and all of that. The third part to early detection is the mammogram. So once you're a woman above 40 years old, you should go for an x-ray of the breast. And what a mammogram does is it can pick a lump 2 years before a doctor can feel it, or you can feel it when you're doing your breast examination. So that's early detection. In Nigeria, are we detecting cancers through screening? Very few. Abroad, UK, US, are they detecting cancers through screening? Yes. And that's why they pick it at the very tiny stage. So that second pillar, early detection, is something women listening and men listening should encourage the women in their lives to go and do their screening, breast self-examination, clinical breast exam, and a mammogram.
So, doctor, you talked about having a 5 pillars of breast cancer control. You've already mentioned 2. Before you go to the third one, I just want you to just hold it there so we can keep a date with our viewers out there. So our viewers out there, I'm sure you've been hearing what the doctor has been saying. We need to keep a date with the physicians out there. Let's hear what you have to say about breast cancer. How supportive have you been to patients that have come down with cancer? Not only breast cancer, but patients that have come down with cancer. Have you been really supportive? Have you rendered help in whatever way or the other? We'll be back after this short break. Stay tuned.
Well, breast cancer, we all know, is a killer disease, but for those victims, they should be encouraged. They shouldn't give up, because when you allow the illness to affect you, fear is the first killer. But as soon as you overcome this fear, you give yourself encouragement. You discover that you even live longer than the expectation. First, you must overcome that fear. And for the family of those who have a breast cancer, they need to, the victim now needs love. He needs affections from the family. People should show concern, they should give that person love, and should let that person feel that he has a family that cares for that person. That care alone will elongate the person's life.
Well, what I can say is this, you know, in life, like as the saying goes, no condition is permanent. And it's also, I'm a Christian, like the Bible said, with God all things are possible, you know. So what I can advise those people is this, to always seek the face of God. There are people who have been there, and they saw the face of God, and eventually they were able to come out of it.
Welcome back. If you have just joined us, you're on to a regular program, The Physicians, where your health is our business. We've been discussing breast cancer, sharing a message of hope, support, and strength. And in the studio, we have Dr. SALAKO OMOLOLA. She is the MD, CEO, and a clinical oncologist, the founder, SEBECCALY Cancer center. So we'll go to Hale and discuss more about the remaining pillars. You have to tell us about the third, the fourth, and the fifth. So let's go ahead.
So the third pillar is diagnosis.
Okay.
So for example, you go for your screening and they detect a lump, or you notice the lump by yourself. We need to confirm certain things. Is this breast cancer or not? If it is breast cancer, what type of breast cancer is this? So when it comes to diagnosis, the most common symptom of breast cancer is a breast lump. There are three things we call it the triple assessment when you're in front of the doctor. The first thing they will do is ask a lot of questions on the lump, when was it detected, and a lot of questions. We call that the clinical history. Then the doctor will go on to examine the breast, the armpit, above the collarbone, and the entire body. The second part to the triple assessment is then to request for imaging. It may be a breast scan or a mammogram, because what you feel on the outside, you also have to see what's on the inside, and that's what imaging does. The third part to the triple assessment is then the biopsy, which is very, very important, because we have to go in, take a tiny sample from the lump, send it to the lab to confirm, is it breast cancer or not, because not all breast lumps are breast cancer.
Sure.
So it's very important that when there's a breast lump or there are changes on the breast skin, we diagnose that it is breast cancer or not. Now, if it is breast cancer, we go on to ask for other tests to confirm if the patient is fit for treatment and what type of breast cancer is it, so that we can give personalized care for the cancer type. So that's it on the third pillar, which is diagnosis. And I'll just jump to the fourth pillar, which is now we've confirmed it's breast cancer. We've done a lot of tests to know the stage. And let's say it's stage 3, because that's the most common type of breast cancer in Nigeria, stage 2 and stage 3. So let's say this woman is 40 years old. She's developed stage 3 breast cancer, invasive ductal carcinoma. We want to treat her. We have to do certain tests to confirm that she can go through all of the treatment. We also want to do certain tests to know if the cancer will respond to this type of treatment, because there's a whole lot of treatment we can do. There are 5 common treatment types. The first one is surgery. We can remove the lump or we can remove the breast. The decision to remove the lump or breast is dependent on the size. If the lump is this big, it doesn't really make sense to remove the lump. You go after the breast, because success in surgery means you have left little cancer cells behind. Not just, oh, the patient stood up and the surgery was successful, little blood loss. No, you actually want to leave as little cancer cells behind, or no cancer cells, because whatever cancer cells you leave behind in future can grow and reoccur. So the second treatment modality is chemotherapy. Chemotherapy are chemicals, are drugs, very powerful, very potent, that we give patients either through a line, an intravenous line, or sometimes tablets. And we give that because sometimes cancer cells have gone round the body, have spread. And we want the chemicals to damage the cancer cells, whether they're in the breast or in any other location. And so chemotherapy, a lot of women are scared of chemotherapy, and it's true, it has a lot of side effects. But when you are being cared for by a team that has experience in treating cancer, then we know how to reduce those side effects. Even if you have an experienced team, you can't prevent all the side effects. It still remains a very tough treatment to deal with. But a lot of women in Nigeria waste time because they are scared of starting treatment. They've heard, oh, their hair will fall off, oh, this will happen, that will happen. But hey, we have cancer in this body. It is threatening the woman's life. If we leave it alone, it can kill the woman. So I know some people are listening. When a doctor says we have to give chemotherapy, it's not because we want you to go through stress. We want you to be alive, stay alive, and our goal is to damage the cancer cells. And a lot of women recover after chemotherapy. It's a tough treatment, but a lot of women, recover after chemotherapy. It's not a pleasant situation when we see women who have a good potential for cure
and are not accepting it.
And they're not accepting
it. Exactly.
It's It's
painful.
It's painful.
Yeah.
It's
Because you just feel this is one that can actually survive and just letting go.
Yeah.
Okay. So the fifth one.
Okay.
Yeah,
Okay,
we've moved from prevention to early detection to diagnosis, treatment.
Okay. So treatment. Yeah. We've talked about surgery, chemotherapy. Then there's radiotherapy.
Yeah.
So usually after breast cancer surgery, chemotherapy, we give radiotherapy, which is a very huge machine. It delivers radiation, like powerful sources of light that damage any leftover cancer cell. Okay. So surgery is not enough for certain stages of breast cancer. We must give chemo, we must give radiotherapy. The last two treatments, targeted therapy and anti-estrogen therapy. Okay. We give it if we confirm that the cancer is positive to estrogen and to HER2. So we may see 5 women with breast cancer. Woman 1 will have positive estrogen, woman 2 will have negative estrogen. For the woman with positive estrogen, it means the estrogen is fueling and feeding the cancer. So we give drugs to reduce the hormones. And so it's based on the tests she has done, and then we personalize treatment based on the type of cancer she has. So that's the
final one, the fifth pillar.
It's around survivorship.
Exactly.
Survivorship. So there are different schools of thought. Some people define a survivor as someone who, after completing cancer treatment, is no more, coming in for active treatment. She's now being called a survivor. But another school of thought says a survivor is someone who has just been diagnosed and is going through the phases. Yeah, through all the phases. And that's the definition I tend to go with. From the moment you are diagnosed with breast cancer, it's your mindset that helps you on this journey of survivorship. And really, when we're counseling our patients at SEBECCALY, one of the frameworks we use is something we formed, and we learned it as we were counseling patients. We call it the gifts of survivorship. G stands for God, I for information, F for family, food and fruits, T for treatment, and S for serenity.
It's very obvious that you have it up there. I really appreciate you. Thank you so much. And to our viewers out there, so just thank you again for keeping a date with us on our program, The Physicians, where your health is our business. We've talked so much about breast cancer, sharing a message of hope, support, and strength. So my final message is that to all women out there, you can stay strong for your loved ones and not to be discouraged. Again, I remain Dr. Martina Agbere. Till next time, stay blessed.
I love the statement that our expert in the house made. Are you born 1st of the month or 30th of the month? Just take that your birthday date and do your breast examination. It's easier for you to remember that. Kindly follow us on all our various social media platforms, Twitter, Instagram, Facebook, and all our previous episodes are on our YouTube page. Please find time to, binge on the Physicians NG YouTube page and chill. If you want to be a part of our program, just like Dr. Salako right here, you are just a click away. Our website is up and running, and the contact link is there for you to send us a mail. My name remains Dr. Memuna Yusuf Kadri. Till next time, remain blessed.